Amblyopia, also called lazy eye, is a condition that affects vision in one eye, making it weaker than the other. It occurs when the brain and the affected eye aren't working together properly, leading the brain to rely more on the stronger eye. Normally, both eyes send images to the brain, and the brain combines these images to create a single three-dimensional view of the world. But in someone with amblyopia, the brain starts to ignore or suppress the signals from one eye. Over time, this can lead to vision problems in the affected eye. It's important to understand that amblyopia isn't just an eye problem. It's actually a brain problem. The eye itself might be perfectly healthy, but the brain isn't processing its signals correctly. It's called lazy eye because the affected eye seems to be lazy, not working as hard as the other eye. But that's not really what's happening. In reality, the brain is favoring one eye over the other. Amblyopia usually develops before age 7, and it's the most common cause of vision problems in children. In fact, it affects approximately 2 to 3 out of every 100 children. If left untreated, it can lead to permanent vision loss in the affected eye. But don't worry, with early detection and proper treatment, most children with amblyopia can achieve good vision. Causes of amblyopia. The problem starts when the brain doesn't receive clear visual information from one eye, so it starts to favor the other, leading to underdevelopment of the weaker eye. There are several specific causes of this problem. Number 1. Refractive errors. This is where there's a significant difference in the focusing power between the two eyes. This can happen if one eye is much more nearsighted, farsighted, or has more astigmatism than the other. The brain gets a clearer image from the stronger eye, so it relies on that eye and neglects the weaker one, causing the vision in the neglected eye to worsen over time. The stronger eye does all the work, while the brain turns off the signals from the weaker eye, which stops developing properly. This type is known as refractive amblyopia, and it is the most common type of amblyopia. Number 2. Strabismus. This is when the eyes are not properly aligned. One eye may turn inward, outward, upward, or downward, leading to double vision. To avoid confusion from seeing two different images, the brain chooses to ignore the misaligned eye and focus only on the image from the straight eye. Over time, the lack of use of the misaligned eye causes its vision to weaken, resulting in amblyopia. This type is known as strabismic amblyopia. Number 3. Deprivation. This happens when something blocks vision in one eye, preventing clear images from reaching the brain. This can be caused by conditions such as congenital cataracts, which cause the lens of the eye to become cloudy, or ptosis, where the eyelid droops low enough to block vision. In both cases, the brain doesn't get proper visual input from the blocked eye, so it relies on the other eye. This type is known as deprivation amblyopia, and if left untreated, it can lead to severe and permanent vision loss. Other risk factors for developing amblyopia include premature birth, small birth weight, family history of amblyopia or other eye problems, and developmental disabilities. Symptoms of amblyopia. The tricky thing about amblyopia is that it often doesn't have obvious symptoms, especially in young children. Many children with amblyopia don't realize they're seen differently from other people. This is why regular eye exams for children are so important, as they can catch amblyopia even when there are no noticeable symptoms. However, there are some signs and symptoms that might indicate amblyopia. One of the most noticeable signs is an eye that wanders inward or outward. This is a sign of strabismus, which can lead to amblyopia. Parents might notice that their child's eyes don't seem to work together, or that one eye looks in a different direction than the other. Some children with amblyopia might have poor depth perception. They might have trouble catching a ball or struggle with other activities that require good hand-eye coordination. This is because depth perception relies on both eyes working together. In some cases, a child with amblyopia might tilt their head or squint one eye when trying to see something. This could be an attempt to see more clearly or to align their eyes. Children with amblyopia might also have noticeable favoring of one eye. They might turn their head to look at things with their good eye, or cover one eye when reading or watching television. For children with refractive amblyopia, there might be signs of struggling to see clearly. They might hold books very close to their face when reading, sit very close to the television, or squint frequently. In some cases, children with amblyopia might complain of eye strain or headaches, especially after doing close-up work like reading or using a computer. It's worth noting that adults who have untreated amblyopia from childhood might notice more obvious symptoms. They might have poor vision in one eye, lack of depth perception, or difficulty with tasks that require good vision in both eyes. Remember, many children with amblyopia don't show any obvious symptoms. The vision in their good eye develops normally, so they might not realize there's a problem with the other eye. This is why regular eye exams for children are crucial. They can detect amblyopia, even when there are no noticeable symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of amblyopia. Amblyopia is usually diagnosed during routine eye exams, often when a child is around 3 to 5 years old. Early detection is crucial, as treating amblyopia is much more effective when the condition is caught in childhood, while the brain is still developing. The eye doctor will start by taking a detailed medical history. They'll ask about any symptoms you've noticed, as well as any family history of eye problems. Next comes the visual acuity test. This is the familiar eye chart test, where you read letters or identify symbols. For younger children who can't read yet, there are special tests using pictures or shapes. The doctor will test each eye separately to see if there's a difference in vision between the two eyes. The doctor will also check how well the eyes work together. They might use a cover test, where they cover one eye and then the other, watching how the eyes move and align. This can help detect strabismus. To check for refractive errors, the doctor will likely perform a refraction test. This involves using a series of lenses to determine the eye's focusing power. In young children, they might use eye drops to dilate the pupils, which allows for a more accurate measurement. In some cases, additional tests may be required to examine the physical structure of the eye, especially if the doctor suspects that a condition like a cataract or ptosis is causing the amblyopia. Treatment for amblyopia. The good news is that with early detection and proper treatment, most cases of amblyopia can be successfully managed. The goal of treatment is to improve vision in the weaker eye and help both eyes work together better. The specific treatment depends on the underlying cause of the amblyopia and how severe it is. Here are the main treatment strategies. Number 1. Correcting refractive errors. If the amblyopia is caused by a refractive error, such as nearsightedness, the first step is usually to correct this with glasses or contact lenses. This ensures that clear images are being sent to the brain from both eyes. Sometimes just wearing the correct prescription is enough to improve vision over time. Number 2. Patching. This is a common treatment for amblyopia. It involves covering the stronger eye with a patch for a certain number of hours each day. This forces the brain to use the weaker eye, helping it develop stronger vision. The duration of patching can vary from a couple of hours a day to most of the day, depending on the severity of the amblyopia. Patching can be challenging, especially for young children, but it's often very effective. Number 3. Atropine drops. Sometimes, instead of patching, doctors might recommend using atropine eye drops in the stronger eye. These drops blur the vision in the good eye, encouraging the brain to use the weaker eye. This can be easier for some children to tolerate than wearing a patch. Number 4. Surgery. In cases of strabismic amblyopia, where the eyes are misaligned, eye muscle surgery may be necessary to correct the alignment of the eyes. This surgery helps the eyes work together more effectively, which can improve the child's overall vision. After surgery, additional treatments like patching or glasses may still be needed to fully correct the amblyopia. Number 5. Treating the underlying condition. For children with deprivation amblyopia, the treatment typically focuses on removing whatever is obstructing the vision in the affected eye. If a cataract is the cause, for example, surgery may be required to remove it. Once the obstruction is resolved, additional treatments like glasses or patching can be used to improve vision in the weaker eye. In all forms of amblyopia, vision therapy may be recommended to help the child develop better control over their eye muscles and improve coordination between the two eyes. This therapy involves a series of exercises designed to strengthen the weaker eye and improve the brain's ability to process visual input from both eyes equally. The exercises are often done at home with the guidance of a vision therapist or optometrist and can be a helpful supplement to other treatments like patching or glasses. Now, we want to hear from you. Have you or your child been diagnosed with lazy eye? What treatments have worked best for you, and how has the experience been so far? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.